Hello everyone, this is Dr.Akshata Shanbhag. Today we are going to learn about the pathological action of Calcarea carbonica. So we all know Calcarea carbonica is the carbonate of calcium. So we will see what is its action on our body. So first main action is on the blood. So what does it do in the blood? It raises the coagulability. It causes congestion in the head and the chest, and it also leads to anemia. So based on this, what all symptoms a person can have? So raising the coagulability means you can use it in hemorrhagic cases where there is excessive bleeding like menorrhagia, metrorrhagia, epistaxis, melena, hemoptysis, hematemesis. So wherever there is a bleeding, you can think of this drug because it helps in coagulation. Second is congestion in the head and chest. Congestion means increase in the vascularization. So what happens when there is congestion in the head or the chest? So there is heat on the vertex, burning in the soles at night, heat in the mouth, but coldness subjective and objective, especially in the palms and lower limbs. So subjectively you will feel, or the patient will feel, or you can also feel, that is objective symptom. The palms and the soles will be very cold, icy cold to touch, while the head is burning heat, so they will feel that heat sensation, and they have fat cough with easy expectoration of the mucus. So this is because of the congestion in the chest. Next is anemia. So because of anemia, we know the person will have pale, waxy, sickly look, pale lips, pale ears, pale fingers, pale and yellowish skin. So next we will see it has action on the impaired nutrition and digestion. So this impaired nutrition and digestion, what does it do? So mainly acts on three areas, that is bones, GIT, and again it will cause anemia, of course. So in the bones, because of impaired nutrition and digestion, what are the symptoms the patient will have? They have deficient and irregular bone development, open fontanelles, crooked spine, deformed extremities, head is larger than the body, slow in walking and teething, and exostosis. So there can be extra growth, bony growth. Then in GIT, what symptoms they will have? Because of malnutrition, they will have sourness in everything. So sour taste will be there, sour eructations, sour vomiting like sour curds, diarrhea also smells sour. So they will have constipation, but generally they feel better when they are constipated, and diarrhea of undigested food fitted with ravenous appetite. They have excessive appetite and offensive stools. Then here anemia, we saw in the previous slide, they will have pallor everywhere. So other than pallor, what all other symptoms you can find here in anemia? Great debility is weakness, then cannot walk far or go upstairs for short breath, easily strained, aggravation from cold air, ascending, exertion, straining from lifting. So they will have these symptoms because of anemia. Then next we will see abscess formation. So it has role in the abscess conditions, wherever abscess in the sense pus formation, suppurations. So especially in deep muscles of neck, thigh, abdomen, if there is abscess formation there, you can think of Calcarea carb. So it helps when silicea cannot be given in cases where abscess is present in dangerous place and has chances of spread. So we have seen that silicea when we study, so in Kent as well as in the Hahnemann says, so as silicea is known as surgeon's knife, or it has the power to excavate the abscess. So if you give abscess where there is in the vital organs, so it can cause spread of those pus formation if it is burst. So what we can do, instead of silicea in such areas in the vital organs, you can give calcareous carb instead of silicea. Then it has roles in the polyps. Polyps is a mucous membrane growth will be there. So especially in the nose, ears, in the vagina, bladder, and anywhere here and there, if there are polyps formation, polyps are present, then calcareous carb should be one drug you have to think about. Then it has action on the glands. So on glands, especially lymphatic glands, pituitary, thyroid, sweat glands, so all the glands it can act mainly on these areas. So what does it do on the glands? The glands will become hard, inflamed, sore, like great nodules, like hickory nuts. Excessive perspiration will occur, especially in the head, in the palms and soles. So these symptoms you will find in the calcareous carb. Then it has action on the muscles. So mainly it causes relaxation. We know the calcium is so much essential for the muscular contraction and relaxation. So here it causes relaxation of the muscles, because of which you find flabbiness, weakness, varicose veins, because it's a smooth muscle. The blood vessels are smooth muscles, so they will have varicosities, varicose veins aggravation from hanging down the limbs, and amelioration by elevating the limbs. Then has action on the nervous system. So nervous system first has action on neuralgia, then cramps, and also in epilepsy. So in neuralgia, what does it happen? There will be trembling, twitching, internal trembling sensation on awaking. So trembling, twitching sensation they will have during neuralgia. Cramps, what happens in the cramps? Cramps in hands at night until she rises in the morning. Cramp like contraction of the fingers. So finger cramps and all they will have frequently. Then epilepsy. So here you have to remember calcareous carb. Epilepsy has an aura which spreads up from the solar plexus, in which case the convulsion comes on immediately. Solar plexus in the sense stomach. So from that area the aura will begin. They will have that sensation and then they will end up with the convulsions. It may be like a mouse running on the arm, or it may run down from epigastrium into the uterus or limbs. So these were the pathological action. Now the same pathological action, if you correlate with the mind, what are the other symptoms, mind symptoms you have in the calcareous carb? They are very slow and sluggish in the both mind as well as body. So they will find slow in movement, apprehension, and they have fear she will lose her reason, or that people will notice her mental confusion. Fears she has some fatal disease, especially heart disease. Evil forebodings, talks of mice, rats, murders, all such things she will speak. Forgetful, confused, very low spirited. Anxiety will be found more in calcareous carb with palpitation. They have averse to work or mental exertion. So easily they will get exhausted. We saw their anemia. Impaired nutrition was one of the pathological action. Same thing, it happens in the mind where they get easily exhausted. They can't put mind for a longer period. So thanks for watching. I hope you have learned a few things about the calcareous carb. So to watch few more such videos, please like, share and subscribe. Thank you.